So today, we're going to dive into a really powerful tool for reshaping the way we think. It's called Cognitive Behavioral Therapy, or CBT for short. And honestly, it's one of the most effective ways to understand and break free from those mental loops that can really hold us back. I mean, have you ever felt like that? Just stuck? Stuck in a loop of negative thoughts you just can't seem to shake? It's such a common feeling, and that is exactly the kind of challenge CBT is designed to help you tackle. So here's our game plan for this explainer. We're going to start with the basics. What even is CBT? Then we'll get into its core idea, the why behind it. After that, we'll look at how it actually works in practice, who it can help, and finally, we'll talk about how to take that all-important first step. All right, first things first, what exactly is this tool we call CBT? Okay, so at its heart, CBT is a type of talk therapy. But, and this is a big but, you really want to pay attention to those two words, structured and goal-oriented. This isn't just about aimless chatting. It is a focused process designed from the ground up to help you make specific, positive changes in your life. And you should know this isn't some new, untested idea. CBT is actually one of the most common and well-studied therapies out there. It's usually a pretty short-term thing, often just 5 to 20 sessions, and its uses are incredibly broad. I mean, it helps with everything from specific mental health conditions to just the everyday challenges life throws at us. Okay, so that's the what, but the really fascinating part is the why. Why is it so effective? Well, the answer is in its core idea, this incredible connection between our thoughts, our beliefs, and our behaviors. It all starts with this one big idea. Our psychological struggles often begin with our patterns of thinking, the stuff that just runs through our heads. And you know, those thoughts don't just stay in your head, they lead to these learned patterns of behavior that might not be serving you very well. And all of that, it's all rooted in something even deeper, these fundamental core beliefs we carry around about ourselves and about how the world works. The real power of CBT is that it helps you look at all three of these layers at the same time. And that really sums up the whole goal here, right? It's an active process. CBT gives you the tools to unlearn the negative patterns that are holding you back, and in their place, learn and practice healthier, more constructive ones. All right, that's the theory. But what does it actually look like when you're, doing it? Let's pull back the curtain on the process. The whole thing is actually pretty methodical, which is great. First up, your therapist works to really understand your challenges, so you can set some clear goals together. Then they'll ask targeted questions to help you explore how you're responding to things. This leads to the big aha moment, where you start to recognize those unhelpful patterns. And finally, that's where the real work begins, actively working to change those patterns and learn new skills. And this is so important to understand. A CBT therapist isn't just there to give you advice. They're more like a partner or a coach who is right there with you, working through the process with you. It's a real collaboration. So you might be thinking, okay, but who is this actually for? Is this for me? Well, the answer is probably. The range of people and challenges it can help is seriously huge. Yeah, I mean, it's a frontline treatment for so many well-known mental health conditions. You've got depression, anxiety, OCD, PTSD, eating disorders, you name it. In all these cases, it provides proven, practical strategies to manage symptoms and just make daily life better. But here's the thing, it's not just for diagnosed conditions, not at all. CBT is also incredibly effective for navigating challenges that pretty much all of us face at some point, like insomnia, chronic pain, relationship problems, grief, or just the stress of adjusting to something new. It gives you real-world coping skills for real-world problems. Okay, so knowing all this is great, but what do you do with it? Let's talk about the practical side of things, about actually taking that first step. And let's be real, this is often the hardest part, isn't it? It feels like this huge hurdle. How would you actually find the right person to help you on this journey? Well, here are a few really practical things you can do. You can always start by asking for referrals from people you trust, like your doctor or family. You can also search online through professional groups. But whatever you do, please always verify that they are state certified and licensed. And just as important, make sure they actually specialize in the specific area you need help with. Finding that right fit is absolutely key. And I just want to leave this section with this really important reminder from the Cleveland Clinic.
Look, acknowledging that you might need help, it can feel totally overwhelming. We get it. But it's so, so important that you do. It's one of the best things you can do for yourself.
So, I want to leave you with a question to just chew on. After everything we've talked about today, what's just one thought pattern you have that you'd like to learn how to respond to differently? Because at the end of the day, that awareness, that's always the very first step to change.